because there's hardly any intrusion here for her deep bite, and you see it's quite a bit of deep bite. I do agree also that there is not much torque. So for example, this one, I don't know if you want to level the gingival margins. I think yes, and there's just not enough torque here. So I do think a bit of intrusion will be good for her anteriorly. And if I look on the lower arch, I just think it could be a bit more, just a bit more. It's just not enough. So now, yeah, you're right. It's still quite retroclined. So we're going to build torque. And one of the ways is, as I've selected those 6 teeth, you see I'm doing lingual torque. One thing I'll also do is a little bit of labial kind of tipping as well. So that looks a lot better than before. Yeah, still a bit upright, but better. And again, this is like just literally no correction. So we're going to remove the super, and I'm going to particularly first start with the centrals, and I'm going to really put them in. They should be a bit like that. Now that I've corrected centrals, we can go all 4 together here and maybe push them a bit more. And perhaps those canines, you see how they are so tipped in. So it's something that a lot of patients would love if they were just tucked out a bit. And I actually think you've got to do a little bit of crown, a little bit of root. And you might have to do some bondings at the end here. Just want to make sure this is not extruding. There's no need for it to actually extrude. So anyways, even this one I think is extruding. Yeah, there's no need for it to extrude. So we just put it back. And I do think you don't really even need the attachments here on the 4s. But this is a little bit more bite correction, better torque. And I'll just change this attachment 3-3 and 4-3 to horizontals, I think, or maybe even verticals, because there's a bit of tipping. All right, so that's about it. But I think about 30-35 aligners in the first set's really good.